welcome to Health Options with me, Rabi, Abdallah. I guess you're familiar with zinc as an element as students of chemistry, but do you know the major role it plays in immune function and anti-inflammation as a micronutrient? Being part of our nature scanner of the program will avail you the opportunity to know a lot about zinc, its functions, symptoms, causes of deficiency, and natural food sources that are rich in zinc. Lack of adequate protective gear and inadequate testing kits is said to be putting medical workers at risk of COVID-19 infection. Negligence on the part of these frontliners has also not been ruled out. Across the world, healthcare workers have been infected while working to save the lives of others. Health Options shall take a look at the basic standard safety precautionary measures expected to be taken by health workers. My guest is the Registrar, Medical and Dental Council of Nigeria, Dr. Tajuddin Sanusi, as we beam our searchlights on doctors. Thanks for joining us on the program. This is Health Options, and our topic is safety of health workers on COVID-19 frontline, with doctors as our focus. And with me in the studio for the discussion is the Registrar, Medical and Dental Council of Nigeria, Dr. Tajuddin Sanusi. Thanks for joining us on Health Options, Dr. Tajuddin Sanusi.
Thank you very much for the invitation.
All right. You have your men out there battling COVID-19, saving lives and getting infected in the process. Let's start with what the Hippocratic oath says. The aspect of safety, I'm sure, is equally captured. Can you let us into that?
Thank you very much. The Hippocratic oath have undergone a lot of amendments. The latest of which was amended in Chicago by by World Medical Assembly in October 2017. The safety of the doctor was actually mentioned in the sense that they should not forget to take care of themselves. Doing that, meaning that if they are in good health, they will be in the proper perspective to offer the same services to people needing them who are our patients, and that is primarily what we are supposed to do. So that is just it. Do not call it physician's pledge, not Hippocratic oath, because before then it was changed to physician's oath. But because of that change in nomenclature by the World Medical Assembly in October 2017, it's now rechristened as physician's pledge. That is why anytime we are inducting new doctors into the profession in this country, we make them to recite the physician's pledge.
Okay. In view of the mandate of your council, that's ensuring quality assurance in the medical profession, and we're discussing safety here, it's been said that we don't have enough PPEs for the health workers. But on the other hand, and I know that efforts are being made to make sure that Nigeria, addresses that. It's not a one country problem. We could see that even the UK at some point, the same thing in the US, they ran out of test kits, even PPEs. So what's your take on the situation, while efforts are being made to close that gap? We've actually also been told that doctors on their part too tend to become negligent. And I can even share a personal experience with you. I took a nephew of mine to a hospital, a private hospital, and the doctor I met there didn't have a face mask on. He was not wearing gloves. And I didn't feel comfortable him attending to us. And when I asked him, he said he didn't have any with him. And I said, it doesn't sound right that he, as a medical expert that will attend to patients, not even knowing our own health status, will sit down there without the right kit. What's your reaction to this?
Well, thank you very much. Even before the issue of pandemics came up, we've always been advising the doctors to protect themselves. In fact, in our Code of Medical Ethics, in Chapter 25, is already coded where the issue of infectious diseases were mentioned. Ordinarily, doctors ought to actually protect themselves. Because let's say, for instance, somebody has a cough disease. He comes in. Cough disease is a transmissible disease. It's a communicable disease. For you as a doctor, you need to protect yourself, meaning that you will need to have what we call some of this face mask, which is necessary to protect you. But with the situation where we have found ourselves globally now, it becomes very important. Of course, there is a shortage globally, but we expect that the employers of labor or people in administrative positions should be able to provide this, but at the same time, the doctors themselves should try as much as possible to protect themselves. Because if you don't protect yourself and you are infected, you can't work. So even if your employer is not even providing this, why not make efforts to even protect yourself? Take, for instance, even the clinical laboratory, the clinical coats will not only put up ordinarily. It's a personal protective equipment, because at times when you take samples and whatever.
Okay, that's the garment.
The garment. Okay. It's part of the PPE. Even the gloves you put on to take samples from the patient is part of the PPE. There are times when you need to examine the patient, you put it on the couch, you need to actually do some kind of elicit some symptoms. You need to protect yourself. So that has been part of the profession on its own. You don't need to be reminded. But with the pandemics and the rate at which this coronavirus is spreading, it becomes very important for us to be extra careful and make sure you protect yourself. And at the same time, be wary of the fact that if you are in a private hospital, you know you are not supposed to take in a COVID-19 patient. Of course, when you suspect that, you just put a call through to the centers, and immediately they will dispatch their vehicles or ambulances to come and evacuate such a patient for proper treatment.
Okay, so like you rightly said, it's a global. The shortage is a global problem.
Yes.
Like I said earlier, the National Health Services, of the UK, even the US, they all have their issues. Even China, at some point, had to mop up those PPEs from other countries. When the virus was raging, at its peak then. So, but what you are saying now is that the doctor should consider the safety, personal safety, even if his employers, employers are expected to provide PPEs anyway, but in the absence of that, the doctor should take his own personal safety in his hands.
Yes.
That's what you're saying.
I agree. Because that one, let me tell you, see, when you look at the employment in this country, the greatest employer of health services is the federal government. How many of us can the federal government actually provide that thing for? But the federal government is trying on its own. But that does not mean that we should not go an extra length, an extra mile to actually protect ourselves. Because let me tell you, in Nigeria, it's only the bad news that spread easily. Good ones will not. If somebody contracts something in that opinion, the news will go around. Don't go to that place, or you can easily be infected. So that is why some of us believe that, apart from the fact that the employer is supposed to provide this thing, what stops you as a registered practitioner practicing in going an extra mile and protect yourself as well?
Well, talking about the bad news, that brings to mind the incident that happened in Kwara, talking about their index case, where a professor, at the teaching hospital, shielded his friend, and that resulted into, an unpleasant development. How do you reconcile that? Compromising professionalism at the detriment of the safety of other people for the sake of maybe family or friendship?
Number one, Trite law says you hear both parties. We've only read of this on the pages of the newspaper. But being the custodian of the conduct of the doctors in the profession in this country, we have taken steps to address that. We have already written to the teaching hospital to actually swear out an affidavit, give the complaint, so that it will be assumed, or you assume that the complaint will be properly laid before Medical and Dental Council of Nigeria. Because if it is not in form of an affidavit sworn to before a commissioner for health or notary public, it is assumed that there is no complaint with the Medical and Dental Council of Nigeria, and we should allow the investigating panel to actually go about its own job by investigating this matter. Now, it is just an allegation. Until the investigation is concluded, it is then we will now know if the doctor has a case to answer or he does not have a case to answer.
So it's still at the level of investigation now. Nothing has
level of complaint. So we have not even received the official complaint from the teaching hospital. Even the way you came across it, it was the way we came across it. We immediately wrote to the teaching hospital so that the complaint can be properly laid before Medical and Dental Council of Nigeria, because we have that responsibility to protect the public, and that's one of the ways we can protect the public.
So while the public is in a great appreciation of what your men out there are doing, the men and women, talking about the medical doctors battling COVID-19 and, you know, saving the lives of, you know, those who have been infected, what have you got to say in terms of upholding professionalism and at the same time considering safety?
You see, first and foremost, by virtue of our mandate in council, which starts with determining the skills and the knowledge to be acquired by people wishing to become medical or dental practitioners, 2, maintaining the registers from time to time, 3, put together the code of conduct to be observed by the registered practitioners, then regulation of homeopathy and other forms of alternative medicine, 5, regulation and control of clinical laboratory practice. In this aspect of COVID-19 now, of course, the pathologists are very active, especially the medical microbiologists and the medical virologists. They are very, very active in this respect, because they are the one that are in that subspecialty.
So what would be your word of advice to those who are really on the front line?
Well, my advice is for them to take care of themselves first, to protect themselves. Once that is done, like the government has said, no private clinic should take in any COVID-19 patient. They should go by that. If you suspect, even you don't need to be suspecting a COVID-19, protect yourself first. By the time you come in contact with that patient and you clerk the patient, you take note of the symptoms and whatever, and you are suspecting that this person may likely be having COVID-19, then quickly you refer the patient. But the important thing is you must protect yourself with the PPE. It's very, very important. But I'm aware there is shortage. Globally, there is shortage of ventilators. But some of these local people here, they've been able to invest, and they are working like the other ones. So that's why I say in one way it's a blessing. In the same way, the so-called protective equipment also, the people who can actually make something like that so that so that can serve the purpose for which it is meant to serve, can also come up with their ingenuity. Are you getting me? And do something which could be tested, and once it's tested and it can serve the purpose, of course, you will now be less dependent on some of these things being imported, which often lead to capital flight. That would have saved a lot of hard currency.
So, which means you subscribe to the encouragement, you know, for the use of alternative therapies in the treatment of COVID-19.
Well, that one. I don't need to be rude to that one, because okay. up to date, because we registered practitioners in this country. Okay. You understand, and we have less than 40 registered up to date. There are some of these people who are parading themselves as alternative medicine practitioners. As far as cancer is concerned, they are quacks because they are not registered. Whatever drug you call it, be it alternative, herbal, or conventional something, there are protocols you need to follow. Okay, so it's about them following the protocols and getting their products validated. Yes, of course. Okay, fine. You see, one used to follow the protocols, are you getting me? And they go through normal tests, and they do the clinical trials, and it's proved to be efficacious and effective. Are you getting me? Yes. Of course, it has passed the test of the time. Okay, so but it's not for you to go and just mix something and say this is this. No. Okay, so on a final note, there will definitely be a post-COVID-19. What's your take on that? My fear about post-COVID-19 is Nigerians going back to the old system. You see, now let us try and institutionalize washing of hands, use of sanitizers, maintaining hygienic environment and what have you. Even after COVID-19, let it continue. But if that stops after this thing, is a big problem. Right. Thank you so much, Dr. Tajuddin Sanusi, Registrar Medical and Dental Council, for coming on Health Options. Thank you very much. Time now to go over to our nature scanner for some enlightenment on the micronutrient called zinc.
Zinc is one of the micronutrients that is actually needed by the body. And I'm glad we have actually differed in our definition. You defined it as an element. That is very true. That is the knowledge that we used to be taught in those days. In secondary school, they say that zinc is an element. And by the time you say zinc is an element, you know that it's an element located on the periodic table. Your teacher will give you a pass mark. But zinc is a micronutrient, and it is one of the most important micronutrients that would come to know today. What is a micronutrient? A micronutrient, as in zinc, is a nutrient that is involved in several biochemical functions in the body. So let me land on the functions of zinc in the body. Zinc is really very important. Zinc is required for our immune system. And I'm sure these days we've been pounding on immune system. That immune system is what actually keeps us, going. So zinc is very important in its role in the immune system. I will come to the specific later. Another function of zinc is that zinc is involved in the structural components of, cells and tissues. What do I mean by this? You know that our tissue is actually supported by the material known as, collagen. Zinc is actually responsible for the laying down of proper collagen so that our bodies will work, properly. That is the function and then the structure. Zinc is also involved in the maturation or the right maturation of the ovum. That is the woman, aspect. So that if you see that with the right maturation of the ovum, then you can overcome fertility issues. Zinc is primarily found in the meat that we eat, be it red meat, be it beef, be it chicken, be it fish. It is especially, and of particular and the highest concentration of zinc is found in, oysters. I don't think that is something we have in very common, but oysters have the richest source of zinc. Now you can also recommend, crab. So people should go on opening crab farms so that we can have natural sources of zinc. So that is one. So that is the meat source. Then zinc is also available in plants. There are certain legumes like beans and the lentils. They also contain the right source of zinc. The caveat, however, in those they contain certain chemicals known as phytates. So beans, for example, is strongly recommended that you soak it very well so that you can get rid of those fighters, because they have other, inimical, benefits. So zinc is also available in, eggs that we eat, and then the plant sources, including our own okra. It is also available in carrots. All these are the different sources of, zinc that we can, take. And on top of that, the supplementation is also required. You take it at a dietary formula. Because, the truth is that our agricultural, practices and lifestyle has actually changed. So we cannot depend on these natural sources that I have mentioned to meet the optimal level that we require. That's why we also encourage, uptake of, supplemental, doses of, zinc. If you look at the combo or the protocol regimen for treatment of, COVID-19 patients, it actually includes zinc. You're talking of, the hydrochloroquine. You're talking of azithromycin. You see, you get the best results if you use zinc as a combination to azithromycin and hydrochloroquine. Another thing you must also put in mind, don't forget our own, vitamins. Vitamin C must go in that combination. Vitamin D must go in that combination, because in that set of combination of hydrochloroquine, azithromycin, zinc, vitamin C and D, you get the best results. Also, zinc is really very, very important in children. Apart from the fact that zinc is involved in formation what we call neurotransmitters of the brain, malformation of zinc can lead to malnutrition, or suboptimal doses of zinc can lead to poor development in children. In fact, there is actually a genetic condition that is actually associated with zinc deficiency. So the children will be born with low IQ if the mother is actually zinc deficient. So it is strongly advocated that zinc should be supplemented in pregnant women as well as young children. Most of these nutrients that I'm talking about, because we are into integrative medicine, we have them in injectable forms. And this injectable form is enough to kickstart you. And once you get at that optimal level, then we will maintain you on the oral dosing. So this is very, very important. Make sure you see your doctor and make sure if the levels are, the doctor will make sure if the levels are terribly low, then they will give you intravenous, infusions to kickstart you, and then you can be maintained on the on the oral doses.
And with that enlightenment on zinc, we conclude this episode of Health Options. A quick reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. Protect yourself and people around you from COVID-19. My name is Rabi, Abdallah. Many thanks for watching. Bye for now.